The ability to communicate is an ability often taken for granted, easily overlooked in the happenings of mundane day-to-day life. But, for the 360 million people worldwide battling debilitating hearing impairments, this is an issue most insurance companies overlook and undersubsidize. Even for patients who do have insurance, they are underinsured for hearing and speech services, thus meaning non-profit companies providing those services receive 50% or less of their invoiced services. In addition to those who are hearing impaired, 7.5 million people in the United States who have difficulty speaking, whether that deals with pitch, loudness, quality, or any variety of speech impediment and/or language disorders such as aphasia, the inability to formulate language due to damage to specific brain regions, are told speech and language therapy is a covered benefit by their insurance provider, but when filing claims, are in actuality denied coverage. In total, nearly 45 million people in the United States have trouble communicating because of hearing issues, speech issues, or both. And sadly, most major insurance companies hand off those life-altering medical conditions to third-party administrators who make the work of treatment centers, speech-language pathologists, and audiologists much harder, in a world unaware of the severity of those unseen conditions. Central Florida Speech and Hearing Center, located in Lakeland, Florida, is one of the only centers statewide specializing in both hearing and speech. Established in 1960, Central Florida Speech and Hearing has been serving the Central Florida area and beyond for over 58 years. What makes the center so crucial to the community and state of Florida is its unwavering mission to serve anyone, no matter how young or old, healthy or sick, or financially stable the patient is. With only 20 out of the 50 states requiring health insurance companies to cover hearing aids, albeit only for children, and only 3 of the 20 states implementing provisions that cover hearing impaired adults, Central Florida Speech and Hearing Center is an essential care provider and a rarity in a society oblivious to the challenges many children and adults face. Meet Zana, a bubbly and bright 5-year-old who loves sparkles and playing with her friends, like most children her age. However, upon a closer look, Zana is wearing sparkly purple hearing aids, devices she needs to allow her to hear the world around her. Zana is mostly deaf in one ear and substantially hearing impaired in the other. Without her hearing aids, she is unable to hear the voices of those who love her the most. With the help of Central Florida Speech and Hearing Center's audiologist Dr. Katie May, Zana is able to hear and catch up on what she has difficulty hearing since she was born.
So we first saw Zana during our kid clinic. And it was apparent right away that she was a very bright child. She really adapted to the testing tasks very quickly, but the results that we were getting were very inconsistent. So we ended up bringing her back to be tested with 2 audiologists at the same time, which is, not a lot of places can do that, but we're lucky that we can do that here. And it was found that she actually has an asymmetric hearing loss. So she has a mild to severe hearing loss in her left ear and a severe to profound hearing loss in her right ear. It's very uncommon for children to have asymmetric hearing losses. And it's interesting because she actually told her guardians that she felt that her right ear was broken, that it wasn't working, and our testing results confirmed that.
Due to Zana's hearing loss, Zana has difficulty speaking and also attends the Center for Speech Therapy under the expert care of speech-language pathologist Kristen Garcia. In a field that is misunderstood and underappreciated by most, Kristen Garcia is paramount in helping Zana stay on track in school and level with her peers.
I came to know Zana because I have a background in working with children who are hearing impaired, and it's a passion of mine. And so what ended up happening was there was a delay in when we knew she had a hearing issue to when she was able to receive hearing aids. And so imagine this standstill for her, and so now she's at a point where these speech and language skills that she should have been developing at these certain times, now she doesn't have. And so it's kind of like if you are chasing after a train. And so her peers are that train, and she's running after them, but they're still running because they're still growing and developing just like she is. Now she's got to make up what she's lost on top of catching up to what they already, to what they're learning too. And so therapy is so important for her because we need to close that gap of that runaway train right now. So some of the skills that she's working on are things that we would expect children with hearing loss to be missing out on. For example, S is a very soft sound, but S has a lot of meaning in our language. So S's are used so frequently when we speak. They are indicative of plural endings. They're indicative of possessive marker. So Zana's had missed hearing the S sound for so long that she's not using it as frequently as she should be. So we see a lot of the skills that she's missing. Often we see other hearing impaired children have difficulty with those skills.
Unique in nature, Central Florida Speech and Hearing Center offers both hearing and speech in one place, perfect for those requiring treatment and rehabilitation, just like Zana. Peggy Floyd, Zana's guardian, speaks on the kind nature of the center as well as the importance of their work. And due to the nature of Zana's case, she has been chosen as the center's Child of the Year, dedicating the center's 2 annual fundraising events in her honor, as well as showcasing her story.
And from the moment we started with Central Florida Speech and Hearing, there was a connection. And I don't mean a parental connection. Zana connected with the audiologist, with the speech therapist, and she just has forever looked forward to coming here each week for therapy. We were very cautious and nervous as parents about her having to wear a device and how the other kids would receive it and really how she would handle it. And it was because of the way they managed her and managed the entire moving into that lane of having to, be in a device pretty much for life. She just acclimated to it, and she has done fantastic with the device. And just the sessions with Miss Kristen has been wonderful and engaging, and she really kind of knows how to connect with Zana and really make the therapy process very engaging and very exciting for Zana. So.
Roxanne Bonta, president and CEO of the center and former audiologist, is well versed in the intricacies of healthcare and is no stranger to the lack of awareness speech, language, and hearing disabilities have in the eyes of the public, as well as the non-existent insurance coverage of the 2 disabilities she spends her days fighting for.
I think people really lack awareness of what we do here. I think that's our biggest challenge. People just don't even consider it. And we are the foundation of literacy. We always say here, you need to hear it, to say it, to read it, to write it. And we are the 2 first things. If children don't have language, there's no reading, there's no success in school. And so we do a lot more language therapy than we do actual, what we call speech or articulation therapy. But we are the foundation of all of that. And as adults too, they just go, oh, I'm getting older, I'm losing my hearing, everybody loses their hearing, and they don't do anything about it. It's like if everyone was walking around without glasses. And the one thing that we're running into right now that actually saddens me is that a lot of older people are getting supplements to Medicare, because Medicare does not cover hearing aids, and they think that they're buying insurance because they go hearing benefits. They think they're buying an insurance that will buy them hearing aids, and in fact what they're doing is they're funneling them to some places and saying you have to buy from this intermediary. Even if you go to an audiologist like us, we have to get the hearing aids from that place, and these patients have to pay. And we can actually provide the hearing aids for less money to these people than the places they're forced to buy them from.
Everyone experiences varying degrees of hearing loss as they grow older, and most times this decline is not made readily apparent until it's too late. Studies have found a link between hearing loss and mild cognitive impairment, a precursor to Alzheimer's disease. Additionally, links between hearing loss and dementia have also been found, another horrible memory disease that not only affects the individual but their loved ones as well. With very few insurance companies covering hearing exams, patients are less likely to get checked for hearing loss, and as a result, less likely to obtain critical early identification and treatment. In addition to the importance of insurance companies recognizing hearing loss, speech-language therapy is of equal importance, and not only for children who have stutters, lisps, or any variety of speech impediments, but for those who have experienced strokes or afflicted with Parkinson's disease. While hearing is underfunded, Speech and language therapy are not even on insurance companies' radars. In the increasingly digital age we live in, the instances in our day-to-day life in which we would converse face-to-face are bypassed with a few taps of a button. For any change to occur in the healthcare hierarchy and the stigma surrounding those who have speech and hearing impairments, those who can voice their concerns and those who can listen must acknowledge the silent disabilities affecting more than 360 million people worldwide, and soon, before the humanity behind communication is forgotten.